Educators, medical professionals, and staff who work in youth-serving organizations, but also for parents and anyone who cares about the well-being of children. At the Monique Burr Foundation for Children, we are dedicated to providing communities with some of the strongest tools available to prevent all types of child victimization. But even with the best prevention efforts, we know abuse still occurs. Whether this topic is new to you or you are taking this training as a refresher, child abuse is not an easy topic to talk about. If you have any difficulty with the topic, please download the printable resource list in the course resource folder and reach out for support. Thank you for taking the time to complete this course and for agreeing with us that child safety matters. In this training, you will learn a lot about child abuse, maybe more than you ever wanted to know. But it is important information because child abuse is an epidemic in our country. During this course, it is our goal to educate you so you understand the reality of abuse and so you can recognize indicators and respond to disclosures. We also want to inform you about the reporting process, so if you ever suspect a child is being harmed, you will know what to do to protect that child and you will feel empowered to do it. Chapter 1, Understanding Child Maltreatment. Please note child abuse and child maltreatment are often used interchangeably. You will see both terms used throughout this course. Myths versus facts. Myth: it's only abuse if it's violent. Fact: physical abuse is just one type of child abuse. There are other types of abuse that are just as damaging. Myth: only bad people abuse their kids. Fact: not all abusive parents or guardians intentionally harm their children. Many have been victims of abuse themselves and don't know any other way to parent. Others may be struggling with overwhelming stress, mental health issues, or substance abuse problems. Myth: abuse doesn't happen in good families. Fact: abuse and neglect doesn't only happen in poor families or bad neighborhoods. These behaviors cross all racial, economic, and cultural lines. Sometimes, families who seem to have it all from the outside are hiding a different story behind closed doors. Myth: most children are abused by strangers. Fact: while abuse by strangers does happen, most abuse, 90%, happens by a family member or others close to the family. Myth: abused children always grow up to abuse their own children. Fact: it is true that abused children are more likely to repeat the cycle as adults, unconsciously repeating what they experienced as children. However, many adult survivors of child abuse have a strong motivation to protect their children against what they went through and become excellent parents. According to research, how many of these 8 children could we expect to be abused or experience some type of trauma before they reach the age of 18? Is it A, 4, B, 1, C, 2, or D, 6? The answer is 2. With that many children being victimized each year, it is likely you may know one. Most children do not spontaneously disclose their abuse, so it is essential that caring adults are educated and empowered to recognize the indicators of abuse, understand the dynamics involved, and be willing and able to report abuse to get help for a child when needed. And they need your help because there are serious, long-term consequences associated with child abuse. The direct impact of abuse on children is often obvious, impacting them in a variety of areas: physical, psychological or emotional, behavioral, health, academic, and families and relationships are often impacted as well. Abuse takes a toll on everyone. To learn more about the ACE study and how ACEs impact children, Here is a clip from a TED Talk on adverse childhood experiences by Dr. Nadine Burke Harris that highlights how trauma, abuse, and victimization impacts growing children and why prevention is so important.
The Adverse Childhood Experiences Study is something that everybody needs to know about. It was done by Dr. Vince Felitti at Kaiser and Dr. Bob Onda at the CDC, and together they asked 17,500 adults about their history of exposure to what they called adverse childhood experiences, or ACEs. Those include physical, emotional, or sexual abuse, physical or emotional neglect, parental mental illness, substance dependence, incarceration, parental separation or divorce, or domestic violence. For every yes, you would get a point on your ACE score. And then what they did was they correlated these ACE scores against health outcomes. What they found was striking. Two things. Number one, ACEs are incredibly common. 67% of the population had at least one ACE, and 12.6%, 1 in 8, had 4 or more ACEs. The second thing that they found was that there was a dose-response relationship between ACEs and health outcomes. The higher your ACE score, the worse your health outcomes. For a person with an ACE score of 4 or more, their relative risk of chronic obstructive pulmonary disease was 2.5 times that of someone with an ACE score of 0. For hepatitis, it was also 2.5 times. For depression, it was 4.5 times. For suicidality, it was 12 times. A person with an ACE score of 7 or more had triple the lifetime risk of lung cancer and 3.5 times the risk of ischemic heart disease, the #1 killer in the United States of America. Well, of course, this makes sense. You know, some people looked at this data and they said, come on, you have a rough childhood, you're more likely to drink and smoke and do all these things that are going to ruin your health. This isn't science. This is just bad behavior. It turns out this is exactly where the science comes in. We now understand, better than we ever have before, how exposure to early adversity affects the developing brains and bodies of children. It affects areas like the nucleus accumbens, the pleasure and reward center of the brain that is implicated in substance dependence. It inhibits the prefrontal cortex, which is necessary for impulse control and executive function, a critical area for learning. And on MRI scans, we see measurable differences in the amygdala, the brain's fear response center. So there are real neurologic reasons why folks exposed to high doses of adversity are more likely to engage in high-risk behavior. And that's important to know. But it turns out that even if you don't engage in any high-risk behavior, you're still more likely to develop heart disease or cancer. The reason for this has to do with the hypothalamic pituitary adrenal axis, the brain's and body's stress response system that governs our fight or flight response. How does it work? Well, imagine you're walking in the forest and you see a bear. Immediately, your hypothalamus sends a signal to your pituitary, which sends a signal to your adrenal gland that says, release stress hormones, adrenaline, cortisol. And so your heart starts to pound, your pupils dilate, your airways open up, and you are ready to either fight that bear or run from the bear. And that is wonderful if you're in a forest and there's a bear. But the problem is what happens when the bear comes home every night. And this system is activated over and over and over again. And it goes from being adaptive or life-saving to maladaptive or health damaging. Children are especially sensitive to this repeated stress activation because their brains and bodies are just developing. High doses of adversity not only affect brain structure and function, they affect the developing immune system, developing hormonal systems, and even the way our DNA is read and transcribed. So for me, this information threw my old training out the window, because when we understand the mechanism of a disease, when we know not only which pathways are disrupted, but how, then as doctors, it is our job to use this science for prevention and treatment. That's what we do.
Some kids may grow up and seem to be fine, but science tells us a different story, particularly through the Adverse Childhood Experiences study. The ACE study was a collaboration between the CDC and Kaiser in San Diego from 1995 through 1997. More than 17,000 health maintenance organization members undergoing a comprehensive physical examination provided detailed information about their childhood experiences of abuse, neglect, and other types of family dysfunction and their current health status and behaviors. The ACE study was one of the largest investigations ever conducted to assess associations between childhood maltreatment and family challenges and later life health and well-being. To date, hundreds of scientific articles have been published, and conference and workshop presentations have been made regarding the study. What this research tells us is that even when we control the risky behavior, there are extremely negative outcomes for children with higher ACE scores. The consequences of these types of adverse events are often painful, severe, disruptive, and potentially life-altering. When a child is exposed to adverse events, social, emotional, and cognitive adaptations are made, as well as physiological changes, all of which can lead to a higher risk of chronic disease, disability, social problems, and ultimately, possibly, an early death. ACEs also impact communities and society. For example, schools are impacted in a variety of ways. In a typical class of 30 students, many students will have experienced at least one ACE. And children with 4 ACEs are more than 40% more likely to have a learning delay, compared with less than 10% for children with 1 or 2 ACEs. Children with 6 or 7 ACEs are nearly 100% likely to have a learning delay. Consider the consequences of maltreatment. What are the annual costs, total direct and indirect costs, associated with child abuse in the U.S.? Is it A, 140 million, B, 25 billion, C, 80 billion, or D, 640 million? The correct answer is 80 billion. So abuse impacts everyone, yet much of this abuse is preventable, and we can all be a part of the solution just by being educated and aware. So let's learn more about abuse. There is no one universal definition of child abuse. It varies by state because each state determines the definitions of child abuse and neglect in statute. The Federal Child Abuse Prevention and Treatment Act defines child abuse and neglect at a minimum as any recent act or failure to act on the part of a parent or caretaker which results in death, serious physical or emotional harm, sexual abuse or exploitation, or an act or failure to act which presents an imminent risk of serious harm. States define abuse in the law, but who investigates and enforces violations of those laws? Child Protective Services agencies determine the appropriate response for the alleged maltreatment based on their state's laws and policies. Some states also define abandonment and/or dependency within the same statute. But for the purposes of this course, we will focus on these 4 types of abuse. We will discuss each type of abuse in detail later in the course when we discuss indicators of abuse. Child abuse is an epidemic. The U.S. Department of Health and Human Services, who tracks data from state reporting agencies, consistently receives over 4 million reports of abuse annually in the U.S. involving 7 to 8 million children. And when you consider that research tells us that most cases of abuse go unreported, these numbers are actually lower than the amount of abuse really happening. The following chart depicts the percentages of the types of abuse reported. Neglect is the highest percentage of cases reported. Who abuses children? Data collected in the U.S. consistently shows the following. The majority of people who abuse children are parents of victims. The largest non-parent categories for perpetrator relationships are relatives other than a parent, an unmarried partner to a parent, and other relationships such as siblings, non-relatives, and babysitters. Both men and women abuse kids, with women accounting for just a bit more than half of all offenders. As you can see, perpetrators come from all walks of life. They are all genders, races, socioeconomic statuses, relationships, etc. Who are victims? Both boys and girls are abused, with girls being abused slightly more than boys. As with perpetrators, victims of maltreatment are all races and ethnicities. While younger children are abused more than older children, even teens are abused. There is no one reason abuse happens, and every situation is different. However, we know there are certain risk factors that have been identified from reviewing past cases that can help us better understand. The social ecological model is a helpful tool to understand the continuum of risk factors that increase the likelihood of a child suffering harm. A risk factor can be individual or environmental aspects of a child's life that increases their risk. You should note one important consideration when looking at risk and protective factors is that these are not casual, meaning just because one or more of these risk factors applies to someone, it does not automatically mean they will be victimized. Likewise, with protective factors in place, it doesn't mean they won't be victimized. You can see that child abuse is clearly not the result of a single cause, but of complex interactions because humans live in a complex environment that influences their development and behavior. When looking at the model as a whole, we can see how individuals, families, communities, and society all have and contribute protective factors to overcome the risk factors. How does this work? Think of a new mom. In each area, there would be risk and protective factors that would put the child at risk. For example, maternal depression, relationship with spouse, any parenting education, support network of family nearby, unemployed, etc. Picture risk and protective factors as two sides of a scale. The more protective factors that you have than risk factors, the less likely you will see child abuse or neglect. The other way around, the more risk factors than protective factors, the more likely you will see child abuse or neglect. The greatest benefit of this model is that we can learn how to protect children and support families by providing proactive, preventative services at all levels, such as educating families, providing supportive family services, implementing supportive family leave policies, etc. Chapter 2. Definitions and indicators. So how do we know if a child is being abused? Sometimes it's easy. A child will just tell us. They disclose someone hit them or someone is touching their privates. However, as you will learn later, this is rare. And abusers rarely point out that they've abused a child. To find abuse, we have to believe abuse is possible, and we have to know what to look for. We must learn what indicators are and why they are important. Let's start with the types of abuse and indicators for each. Physical abuse is any non-accidental injury or injuries to a child. A serious physical injury by other than accidental means, a substantial risk of serious physical injury by other than accidental means, cruel or inappropriate procedures or use of cruel or inappropriate devices to modify behavior, for example, for discipline purposes. Examples include harmful restraint, beating, use of an instrument, punching, biting, burning, shaking, or kicking. Physical indicators or suspicious injuries. They can include bruises or welts on the face, lips, mouth, torso, back, buttocks, or thighs, linear bruises, clusters of bruises or welts, human bite marks, bald spots, hair loss, fractures, burns, head injuries, injuries to infants, injuries that look intentional or inflicted, rather than those that would occur more naturally from a fall or other childlike accidental movement are important to note as well. Anytime you are unsure, it is best to consider it a suspicious injury and make a report. How do you know if an injury is accidental or suspicious? Children are objects in motion and are often injured. Think of how and where accidents usually happen with kids. They are generally moving in a forward motion, and when they fall down, they fall forward. So for example, they skin their knees or bruise bony areas such as their forehead, nose, and chin. Usually, soft tissue injuries are suspicious injuries, and injuries that occur on both sides are often suspicious as well. Kids usually fall to one side. Burns can also be suspicious or accidental. To know, you need to consider the shape, location of the burn, and the story. Abusive head trauma, sometimes referred to as shaken baby syndrome, a specific type of physical abuse that happens from shaking a newborn, infant, or small child by the arms, legs, shoulders, or trunk of the body. There are short-term symptoms, breathing difficulties, apnea, poor sucking or swallowing, lethargy, vomiting, unequal pupils, rigid body, broken ribs, inability to lift head or track movement with eyes, and long-term symptoms, subdural hematomas, blindness, seizures, learning disabilities, physical disabilities, and death. Triggers can include parent frustration with crying, child's perceived misbehavior, perceived need for discipline, argument, family conflict, toilet training conflict, or lack of sleep. Behavioral indicators. Despite physical abuse often leaving marks on children, adults may miss physical indicators. It's important to also note that behavioral and/or academic indicators associated with physical abuse may be more easily recognized. These can include children wearing clothing that is not appropriate for the weather, excessive absences from school, being fearful of parents or other adults, extremely aggressive or passive behavior, easily agitated or defensive, hyperactivity, impulsivity, low frustration tolerance, depression, low self-esteem, suicidal tendencies, constantly tired, unable to stay awake, cognitive or intellectual impairment, deficits in speech and language. If you suspect abuse but you're not sure, consider the following. Could the injury or injuries have happened the way the child or parent described them? Does the story make sense with the injury? Is the child developmentally capable of injuring themselves in the manner described by the parent or caretaker? If you answer no to either of these questions, you have reasonable suspicion to make a report. Is spanking considered discipline or abuse? While 62 countries have banned physical discipline in line with United Nations recommendations, spanking remains legal in all 50 states in the U.S., and corporal punishment in schools remains legal in 19 states. However, if spanking injures a child, it can be considered physical abuse. Multiple studies have shown that spanking is not an effective form of discipline. Discipline should be a consistent, patient learning process with a goal of teaching appropriate behavior. Emotional abuse is a pattern of verbal assaults or coercive measures against a child, which is destructive to the child's sense of self-worth. It can include criticizing the child for developmentally normal behavior, setting unrealistic expectations, shaming or belittling the child, blaming or using the child as a scapegoat, treating the child differently from other children, rejecting, ignoring, or taking little or no interest in the child, withholding physical needs such as food, sleep, shelter, and emotional needs such as love and affection, terrorizing the child with extreme threats, and isolating the child. Physical indicators for emotional abuse can include speech disorders, lags in physical development, sallow, empty facial appearance, loss of bladder or bowel control. Behavioral indicators can include anxiety, poor relations with peers, disruptive, impulsive, aggressive, oppositional, or defiant behaviors, passive or overly compliant, overly controlling or rigid, depressed, withdrawn, isolated, and even habit disorders such as biting or thumb sucking. Neglect is the failure to provide for the child's basic needs. Despite available resources, a child's needs are not met. The parent is unwilling to provide for the child's care, or the parent is unable to provide care due to circumstances such as poverty or a lack of resources. People often think of reporting a family to a child welfare agency as a bad thing. However, it is often beneficial in situations when a parent simply lacks the needed resources to provide for their child. It can help parents gain access to much needed services and support, such as assistance with food, housing, childcare, etc. Types of neglect. Physical neglect is when children are not provided with things they need to be healthy and safe, such as food, clothing, or shelter. Medical neglect is when children are sick or injured and are not taken to the doctor or provided with needed medical care. Emotional neglect is when a parent or guardian withholds love and attention from a child or teen or repeatedly says hateful or emotionally harmful things to them. Other types of neglect include inadequate supervision, exposure to a dangerous environment such as drugs or domestic violence, or failure to provide an appropriate education. Physical indicators of neglect can include undernourished, lethargic, untreated injuries, chronic injuries due to a lack of supervision, including being harmed by others. Behavioral indicators can include stealing, hoarding, or begging for food, noticeably poor hygiene, risky behavior, developmental delays not caused by a disability, clingy behavior, and poor ability to relate to others. Sexual abuse is any sexual behavior imposed on a child. It includes both contact and non-contact offenses. Physical acts perpetrated upon a child may include sexual intercourse, oral genital contact, fondling, masturbation, and sex trafficking. Non-touching acts perpetrated upon a child may include showing or taking explicit pictures or video, exhibitionism, and inappropriate sexual conversations. Sexual abuse facts. 1 in 10 children will be sexually abused before their 18th birthday. Any child can become a victim, any race, age, gender, or sexual orientation. 90% of victims are abused by a family member or someone they know. 1/3 of victims are abused by another child or teen. Very few sexual abuse allegations are fabricated. Very few offenders are ever prosecuted. No study indicates that public notification of sex offenders or the sex offender registry helps to lower sexual abuse. Who sexually abuses children? Perpetrators can be anyone, any race, gender, profession, socioeconomic status, sexual orientation, or marital status. They are often someone the child knows. They tend to groom a child and the family. They tend to have a radar for at-risk children. They often establish a secrecy around a special relationship with the child. They are mostly males. However, females do offend, and female offenders may be underreported. They want to be where children congregate to have easy access to victims. They may be more comfortable around children than adults. They may themselves have been victims. About 25 to 30% of adult sex offenders were child sexual abuse victims, and many offenders were exposed to domestic violence or physical abuse as a child. Factors that may increase a child's risk for sexual abuse. Children are naturally curious about sexual matters, and this may increase their exposure and risk. Children have been told to respect and obey adults, and this may lead to them keeping the abuse hidden. Children's creative attention, affection, and approval from adults. Recognizing sexual abuse. It may be difficult to see any physical indicators that sexual abuse has occurred. It is more likely that you will see behavioral indicators or notice changes in a child's behavior, or the child may say something that will cause you to suspect sexual abuse. Physical indicators of sexual abuse can include torn, stained, or bloody underclothing, pain, swelling, itching, bruises, bleeding, or lacerations of the genital, vaginal, or anal areas, vaginal or penile discharge, loss of bladder or bowel control, unexplained abdominal pain, pain when urinating or passing stool, discomfort or difficulty walking or sitting, sexually transmitted diseases, urinary tract or yeast infections, or pregnancy. Behavioral indicators include sudden reluctance to go to people or places where they used to feel comfortable, eating or sleeping disturbances, drop in academic performance, aggressive or regressive behavior, trying to be perfect, trying to meet needs of adults, depression, nervousness, eating disorders, early knowledge of sexual matters or excessive masturbation, or even promiscuity in adolescence. Child sexual exploitation. Many children who are sexually abused are also sexually victimized online and/or exploited for commercial sex, otherwise known as trafficking. Oftentimes, children who suffer child sexual abuse are also exploited and their images or videos are shared online. The internet makes it easy for predators to locate potential victims, communicate with them, and groom them for sexual acts, including trafficking. Other facts that may surprise you: 1 in 5 youth between the ages of 10 and 17 has received unwanted sexual solicitations online. 1 in 4 youth has been exposed to sexually explicit pictures online without seeking or expecting them. Many states now require mandated reporters to also be able to identify, recognize, and report suspected child sexual exploitation or trafficking. Knowing the indicators of exploitation and trafficking are important, but are much more involved than can be covered in this training. Please know that NBF offers additional online trainings that address this topic in more detail, as well as other types of victimization, including protecting children from sexual abuse, preventing, recognizing, and responding to human trafficking, and real-world safety, protecting youth online and off, a bullying, cyberbullying, and digital safety course. If you see something that is a red flag, an indicator, or a behavior, and suspect abuse may be happening, then err on the side of caution and report it. You do not have to prove abuse is happening. Reporting abuse is a way to request a service for an investigation to determine if a child is in danger or not. You do not need to know for sure. Trust the professionals. Chapter 3, Disclosure. Responding to disclosures of abuse. So you've learned about indicators and should be more prepared to recognize signs of possible abuse or neglect. You may also have a child disclose abuse to you, and you need to be prepared in the event that happens. With many schools and organizations teaching prevention education, this is much more likely. Why don't kids disclose? There is a sense of shame associated with the abuse. There is a sense of loyalty to the abuser. There is a real fear of not being believed, or there is a fear of negative consequences to the child or to family members. There are different types of disclosures. Disclosure is never easy for a child. It is often a process over a period of time, not a one-time tell-all event. A child may test the waters with you to see how you will respond. If a child discloses to you, There are a couple of things you need to keep in mind. Remember, they chose you. They trust you. This is difficult for them to disclose abuse or neglect. Let the child know that you believe them. Be supportive, listen intently, and be empathetic. Be aware of your own feelings. Try to remain calm and non-judgmental. Listen more than talk. Find a private place to talk with the child. Keep the talk brief. Write down everything the child reported to you. Be truthful. They need to know you are concerned for their safety and are not going to be able to keep this a secret. Remember, you are responsible for reporting. Any organizational policy is secondary to your state law about reporting. If you have your own issues, please get help and deal with them separately. Be present for the child in this moment and keep your emotions in check. When responding to disclosure, do make sure to believe, support, and reassure the child, understand your limits, provide a quiet, safe environment, ask limited, open-ended questions, seek help and advice when needed, and report any suspicions of abuse and neglect. Also making sure that you don't make assumptions or promises that you can't keep, interrogate or investigate, put words in the child's mouth, talk negatively or be judgmental about the abuser. It is often someone the child loves and trusts. Show shock or other emotions as it may cause the child to shut down. Have other people around or take the child to disclose to someone else. And never assume someone else will report abuse. Chapter 4, Reporting Abuse and Neglect. If a child discloses abuse or neglect, or if you have reasonable suspicion that a child has been abused or neglected, you should make a report to your state's Child Protective Services agency via phone, email, or online form. If you aren't sure if you should make a report, you can contact CPS to make an inquiry. They will determine if a report is necessary. They may also refer you or your case to law enforcement. Some professionals who work with children are considered mandatory reporters and are required by law to report. In some states, every citizen is a mandatory reporter. Document everything. And if a child is in immediate danger, call 911. Reporting abuse and neglect, frequently asked questions. Who is required to make a report? Who is making reports? Why should I make a report? How do I make a report? What do I report? What happens after a report is made? What if nothing happens after I make a report? What can I do to support the child after I make a report? What will happen if I don't report? Why don't more people report? Who is required to make a report? Every state defines who is required to report child abuse and neglect. In some states, professionals who work with children and youth are considered mandatory reporters, while in other states, every citizen is a mandatory reporter. Find out more about reporting child abuse and neglect and about your state's reporting law at the website on your screen. Who is making reports? The chart depicts the percentage of reporters. By far, the most reports are made by educators, law enforcement, and other legal providers, and human service providers. Why should I make a report? You may have a professional responsibility. However, regardless of what the law says, we all have a personal responsibility. Everyone should report any suspicion of abuse or neglect because it's the right thing to do to protect children. For the safety of the child being abused, it may help prevent ongoing abuse and neglect. For the safety of other children, it may help protect other children who may be at risk. It's also a good way to help educate the family and ensure they gain access to needed resources and support. Timely reporting and subsequent intervention can help prevent the long-term consequences and impact of abuse and neglect and assist with healing. How do I make a report? Every state has a child welfare or child protective services agency that takes reports of child abuse and neglect. You can find your state's specific information online. Visit the website on the screen. Many states have a reporting hotline number that is staffed 24 hours a day, 7 days a week, and many allow online reporting as well. What do I report? You will need the child's information such as name, age, address and/or current location, the adult's information if you have it, details about the abuse, and other information may be asked. You don't have to have proof that abuse has occurred. You are simply reporting your suspicions. It is the job of the Child Protection Agency to investigate and confirm if abuse has occurred. What happens after a report is made? Once a report is made to a Child Protective Services agency, it will either be screened in or screened out. A report is screened in when there is sufficient information to suggest an investigation is warranted. A report may be screened out if there is not enough information on which to follow up or if the situation reported does not meet the state's legal definition of abuse or neglect. If it is screened in, an investigation takes place and a caseworker determines if a report is founded or unfounded. If founded but risk to child is low, the child may stay with the family and the family will gain access to services and support. If founded but risk to child is high, the child will be removed from the home and placed with other family members or into foster care while parents or caretakers work with social services to ensure the child's safety. In some cases, the child may be removed from the home permanently. To better understand the child welfare system, visit the link on the screen. What if nothing happens after I make a report? If you make a report and it is not accepted, you may ask for an explanation. There are many reasons this may happen. The case may have been referred to law enforcement. The case may not have met the criteria established by state statutes. The child may not have been ready to share their story with the CPS investigator. The child may have recanted. If you are not satisfied with the outcome, ask to speak with a supervisor to understand why. If you have continued concerns, keep reporting and keep documenting everything. What can I do to support the child after I make a report? Try to maintain the child's usual routine so they have a sense of normalcy and safety. When appropriate, give the child choices to help them have a sense of control. Designate a safe space and a supportive adult they can go to if they are feeling upset. Validate their feelings, even if they are displaying those feelings through disruptive or negative behaviors. Help them learn to recognize the emotion behind the behavior and learn to find more positive ways to express themselves. When needed, advocate for academic or environmental modifications to support the child. Ensure the child's right to privacy and confidentiality is protected. What will happen if I don't report? A child may be harmed or even killed. Almost all states have penalties for the failure to report by a mandatory reporter. Penalties may range from a misdemeanor to a felony with punishments including possible jail time and/or fines. Learn more about your state's law by visiting the website on your screen. Why don't more people report? That's a good question. People may hesitate to report because they question themselves. There are a lot of what-if questions you can ask. What if I'm wrong? What if nothing happens? What if the abuser sues me? What if the abuser retaliates against me, my organization, or the child? But what if you're right and something does happen, and it protects a child? The truth is, all of those things could happen, but also, the truth is, we can only do the best we can do, and then we have to trust the system. At the end of the day, if you believe you are doing what is right to protect a child, then you are doing what is right. You may have heard horror stories about CPS or even have had some bad experiences yourself. But there are some very good social workers out there these days, and our system is working to provide people with access to services to help families achieve better outcomes. We must try to contribute positively to that success. There are often barriers that inhibit people from reporting abuse. In this last part of the training, we will discuss those barriers and how to overcome them so children are better protected. What are the personal barriers to reporting and how do we overcome them? Many people think abuse and neglect can't happen in certain types of families, or they may like a family or think a family's business is their own and not want to get involved. However, abuse and neglect can happen in any family, and we have to accept that reality so we are able to see children that need our help. A child's safety and well-being should always be our top priority. When we aren't educated about the indicators of abuse, they may be easily missed. When we know better, we do better. Different families and cultures have different beliefs about spanking or other types of discipline. However, the law is clear that if discipline is harmful to a child and injures them, it is abuse. What are the system or agency barriers to reporting and how do we overcome them? Staff may be unsure who to call, or there may be conflicting policies about who should make a report. Someone may have had a previous negative experience with a child protective agency and feel making a report is pointless. There may be a concern for the reputation or finances of the agency, or staff may be concerned about losing their job. We can avoid issues when everyone remembers that our priority is to protect vulnerable children. Some agencies require that you report to one person and they make the call to CPS. However, this does not exonerate you from the state's mandatory reporting requirements. If you feel as though the designated reporter has not reported within 24 hours, then you must go ahead and make the report yourself. It is always best to do so in order to answer any questions they may have, especially if the child has provided you with the disclosure. Chapter 5. What else can I do to protect children? Start with yourself, your family, and your organization. Educate yourself and model appropriate behavior and positive discipline techniques in your interactions with children. Sometimes adults don't know how to respond to certain behaviors, so if you model that for others, they will become better educated. Seek help if and when you need it. It's okay to admit we don't have all the answers. Be a support to friends, neighbors, and other adults who may be struggling and need help. If you are a professional working with families, create and provide a community resource list of available resources in your community, such as respite services, childcare, financial assistance, support groups that can help families in times of need. If parents are struggling, showcase their strengths and be a support system. Sometimes families lack a support system, and it's easy to turn away as we're just a provider of services. However, if you can partner with parents with the shared goal of success for their children and family, you may be the support they need to help them avoid maltreatment. Be an ally to families and provide a non-judgmental listening ear if they need to talk. Be aware and reach out to families that may be dealing with increased economic or personal stressors. Partner with other community agencies to provide additional services and resources to families, such as food, trainings, parenting classes, etc. Go even further. Learn more about the topic of child abuse and neglect and talk about the issue with other adults to help better educate and empower them. Be an advocate for prevention. Learn more about NBF prevention education programs and make sure the programs are in your local schools. It's important that adults know how to recognize and respond to abuse, but it's even better if we are proactive and prevent abuse from happening in the first place. Educating both adults and children is essential to preventing abuse. NBF programs can help with this. Get involved with organizations in your local community that work to prevent and stop abuse. Reach out to your local child advocacy centers or other child abuse prevention organizations and ask how you can help. NBF has 3 school-based programs: NBF Child Safety Matters for grades K through 5, and NBF Teen Safety Matters for middle school grades 6 through 8, and NBF Teen Safety Matters for high school for grades 9 through 12. All of our programs are comprehensive and cover bullying, cyberbullying, the 4 types of child abuse, physical, emotional, sexual, and neglect, and digital dangers. In middle and high school, they also cover relationship abuse, sexual assault, exploitation, and human trafficking. NBF also has two extracurricular programs, NBF After School Safety Matters for after-school programs and youth-serving organizations, and NBF Athlete Safety Matters for youth athletes in sports settings. These programs are based on the same theories and best practices as our school-based programs and cover the same comprehensive topics, but they are delivered in different settings and complement